Hello everybody, Namaste. I'm Dr. Mandeep Director for Oncology at CK Birla Hospital in New Delhi. So as a follow-up to a previous video about the tobacco abuse and its problem it creates, we just want to put our effort forward to just put some information of how to quit this habit and how we just want to generate few things that if somebody who intends to quit this thing, so how they can go about doing these things. So first of all, the quitting or stopping or abstinence from tobacco and its abuse, it has to come from the within part or the personal intent and the willpower of the person. That is the first and primary thing which is there. If there is no willpower, if the personal intent is not there, then it is very difficult to quit, and ultimately the relapse would happen. So first of all, we have to, if somebody is not motivated to do this, so we have to motivate and convince them to stop using this dreaded substance. But first thing obviously comes that the personal willpower. Then comes the support from the friends, family members, the social network, and even professional network. So if somebody is incentivized professionally by quitting substance abuse, obviously the results are much better. Friends and family support is of prime importance when somebody is intending to do these things. Then third role comes for the healthcare providers. The healthcare providers like doctors and all, or the rehabilitation centers, or when what is there is that if somebody is into a very high substance abuse, so they would look into how to get the nicotine withdrawal, or they might look into nicotine replacement therapies, so that the quitting becomes easy and it's not a very dreadful or challenging job to quit. So if we are able to make these things easier, obviously the results much important and much better results. So that is, and nicotine replacement therapies or any of these therapies has to come under the supervision of healthcare. It should not be done by somebody on it, so that results are not good. And apart from medical management, even psychological and behavioral management, the cognitive therapy, the counseling, and everything plays a very important role in achieving the success of quitting tobacco. So the personal willpower, the support from the friends and the family, then the incentivization at the professional places, and then comes the role of third, healthcare providers, and last is now the awareness. Awareness is that there is a quit line, helpline, there is some mobile apps, and all these things somebody should definitely use their help also, so that when the quitting happens, it becomes lifelong, it doesn't relapse. So for preventing relapse, obviously we have to take care of the healthcare providers to manage the withdrawal symptoms, to make sure that the psychological and social and behavioral tendencies to go back are minimized, and there should be a constant support from the friends, family, social network, and even professional network. So I really want to put this message forward that please do try to abstain from such substances, and if you are into substance abuse, and if any kind of help we can provide you with, we'll be happy to do that. And as a follow-up to the World No Tobacco Day, we just want to create this awareness so that we can prevent dreaded diseases like cancer, heart disease, and even pulmonary diseases. Thank you.